Dental Services. Appendix PP, Regulation Section 483.55, tags F790 through F791. Begin reading. Tag F790. Section 483.55, Dental Services. The facility must assist residents in obtaining routine and 24-hour emergency dental care. Section 483.5, 5A Skilled Nursing Facilities. A facility. Section 483.5, 5A1 must provide or obtain from an outside resource, in accordance with Section 483.7, 0F of this part, routine and emergency dental services to meet the needs of each resident. Section 483.5, 5A2 may charge a Medicare resident an additional amount for routine and emergency dental services. Section 483.5, 5A3 must have a policy identifying those circumstances when the loss or damage of dentures is the facility's responsibility and may not charge a resident for the loss or damage of dentures determined in accordance with facility policy to be the facility's responsibility. Section 483.5, 5A4 must, if necessary or if requested, assist the resident in making appointments, and II, by arranging for transportation to and from the dental services location, and Section 483.5, 5A5 must promptly, within 3 days, refer residents with lost or damaged dentures for dental services. If a referral does not occur within 3 days, the facility must provide documentation of what they did to ensure the resident could still eat and drink adequately while awaiting dental services and the extenuating circumstances that led to the delay. Tag F791. Section 483.55, Dental Services. The facility must assist residents in obtaining routine and 24-hour emergency dental care. Section 483.5, 5B Nursing Facilities. The facility. Section 483.5, 5B1 must provide or obtain from an outside resource, in accordance with Section 483.7, 0F of this part, the following dental services to meet the needs of each resident. Routine dental services to the extent covered under the state plan, and II, emergency dental services. Section 483.5, 5B2 must, if necessary or if requested, assist the resident in making appointments, and II, by arranging for transportation to and from the dental services locations. Section 483.5, 5B3 must promptly, within 3 days, refer residents with lost or damaged dentures for dental services. If a referral does not occur within 3 days, the facility must provide documentation of what they did to ensure the resident could still eat and drink adequately while awaiting dental services and the extenuating circumstances that led to the delay. Section 483.5, 5B4 must have a policy identifying those circumstances when the loss or damage of dentures is the facility's responsibility and may not charge a resident for the loss or damage of dentures determined in accordance with facility policy to be the facility's responsibility, and Section 483.5, 5B5 must assist residents who are eligible and wish to participate to apply for reimbursement of dental services as an incurred medical expense under the state plan. Intent of Section 483.5, 5AF 790 and BF 791. To ensure that residents obtain needed dental services, including routine dental services. to ensure the facility provides the assistance needed or requested to obtain these services. To ensure the resident is not inappropriately charged for these services, and if a referral does not occur within 3 business days, documentation of the facilities to ensure the resident could still eat and drink adequately while awaiting dental services and the extenuating circumstances that led to the delay. Definitions for Section 483.5, 5AF 790, and BF 791. Emergency dental services include services needed to treat an episode of acute pain in teeth, gums, or palate, broken or otherwise damaged teeth, or any other problem of the oral cavity that required immediate attention by a dentist. Promptly means within 3 business days or less from the time the loss or damage to dentures is identified, unless the facility can provide documentation of extenuating circumstances that resulted in the delay. Routine dental services means an annual inspection of the oral cavity for signs of disease, diagnosis of dental disease, dental radiographs as needed, dental cleaning, fillings new and repairs, minor partial or full denture adjustments, smoothing of broken teeth, and limited prosthodontic procedures, e.g., taking impressions for dentures and fitting dentures. Guidance for Section 483.5, 5AF 790, and BF 791. A dentist must be available for each resident. The dentist can be directly employed by the facility, or the facility can have a written contractual agreement with a dentist. The facility may also choose to have a written agreement for dentist services from a dental clinic, dental school, or a dental hygienist, all of whom are working within federal and state laws, and under the direct supervision of a dentist. For Medicare and private pay residents, facilities are responsible for having the services available, but may bill an additional charge for the services. For Medicaid residents, the facility must provide all emergency dental services and those routine dental services to the extent covered under the Medicaid state plan. The facility must inform the resident of the deduction for the incurred medical expense available under the Medicaid state plan and must assist the resident in applying for the deduction. If any resident is unable to pay for dental services, the facility should attempt to find alternative funding sources or delivery systems so that the resident may receive the services needed to meet their dental needs and maintain his or her highest practicable level of well-being. This can include finding other providers of dental services, such as a dental school or the provision of dental hygiene services on site at a facility. The facility must assist residents in making arrangements for transportation to their dental appointments when necessary or requested. The facility should attempt to minimize the financial burden on the resident by finding the lowest cost or no-cost transportation option to dental health care appointments. The facility must have a policy identifying those instances when the loss or damage of partial or full dentures is the facility's responsibility, such as when facility staff discards dentures placed on a meal tray, a blanket policy of facility non-responsibility for the loss or damage of dentures, or a policy stating the facility is only responsible when the dentures are in actual physical possession of facility staff would not meet the requirement. In addition, the facility is prohibited from requesting or requiring residents or potential residents to waive any potential facility liability for losses of personal property. See Section 483.1, 5A2 Roman 3, F620, Admissions Policy. Prompt referral means no later than 3 business days from the time the partial or full dentures are lost or damaged. Referral does not mean that the resident must see the Dentist at that time. It does mean that an earliest possible appointment referral is made, or that the facility is aggressively working to have the dentures repaired or replaced if the dentist was contacted timely and determined the dentures could be repaired or replaced without a dental visit. If there is a delay in making the referral, the facility must document the circumstances that led to the delay. The facility must also be able to provide documentation demonstrating what they did to ensure the resident could still adequately eat and drink while waiting for the issue with their dentures to be addressed. If concerns are identified regarding providing ADL assistance for oral hygiene, such as assistance with brushing, flossing, denture cleaning, do not cite here. See guidance under Section 483.24a, F677, Activities of Daily Living. Summary of procedures for Section 483.5, 5AF 790, and BF 791. The process to review concerns are outlined in the dental care area pathway. Record review. Review the resident's records for identification of the resident's dental needs and the resident's responsiveness to dental services, the information found in the resident's assessment and care plans should be used to guide resident observations and to determine whether the facility has met or is meeting related regulatory requirements including, but not limited to, person-centered care planning, resident assessment, and dental services. Finally, determine the resident's payer status: Medicare, Medicaid, or private pay-for service eligibility determinations. Observation. Observe the resident to determine if his or her dental status is consistent with the comprehensive assessment, or if the resident exhibited signs of dental health concerns that may not have been identified. Resident/resident representative interview. Interview the resident and/or resident representative to determine if any concerns identified since the last survey were promptly addressed to the residents or the resident representative's satisfaction. This includes determining if the facility provided the assistance to obtain dental services needed or requested by the resident or resident representative, and whether the facility assisted the resident with arranging transportation to the dental appointment, if the identified concern is related to missing or damaged dentures. Interview the resident and family/resident representative to determine if a referral was promptly within 3 business days made, if an explanation was provided if a referral was not promptly made, and if the facility took measures to ensure the resident was able to continue to eat or drink adequately while awaiting dental services. Key elements of noncompliance. To cite deficient practice, the surveyor's investigation will generally show that the facility any of the following. For residents receiving Medicare and private pay residents, F790 failed to provide or obtain from an outside resource in accordance with Section 483.70F routine and emergency dental services to meet the needs of each resident, or did not assist the resident as necessary or requested to make appointments for dental services and/or arrange for transportation to and from the dental service location, or did not promptly, within 3 business days, refer a resident with lost or damaged partial or full dentures and/or documented the extenuating circumstances that led to a delay, or did not document what the facility did to ensure a resident with missing or damaged dentures could still eat and drink adequately while awaiting dental services, or charged a resident for the loss or damage of partial or full dentures determined to, by facility policy, to be the facility's responsibility. For residents receiving Medicaid, F791 failed to provide or obtain from an outside resource in accordance with Section 483.70F. Routine to the extent covered by the state plan and emergency dental services for each resident, or did not assist the resident as necessary or requested to make appointments for dental services or arrange for transportation to and from dental services locations, or did not promptly, within 3 days, refer a resident with lost or damaged partial or full dentures and or documented the extenuating circumstances that led to a delay, or did not document what the facility did to ensure a resident with missing or damaged partial or full dentures could still eat and drink adequately while awaiting dental services, or charged a resident for the loss or damage of partial or full dentures determined to by facility policy to be the facility's responsibility, or failed to assist a residentess who are eligible to participate and or wish to participate to apply for reimbursement of dental services as an incurred medical expense under the state plan, or charged a Medicaid resident an added fee for routine dental services covered by the state plan or for emergency dental services. Additional tags for consideration may include, but are not limited to, Section 483.10G14, F790, Notification of Change. Determine whether staff notified all necessary care providers and resident representatives of change in dental/oral condition when required. Section 483.20BI, Roman 3, F636, Comprehensive Assessment. Determine if the facility comprehensively assessed the resident's risk and or underlying causes to the extent possible of the resident's dental/oral condition and the impact upon the resident's function, mood, and cognition. Section 483.20G, F641, Accuracy of Assessments. Determine whether the assessment accurately reflected the dental condition of the resident at the time of the assessment. Section 483.21B1, F656, Comprehensive Care Plan. Determine if the facility developed a care plan based on the comprehensive assessment to address the resident's dental/oral condition. Section 483.25G13, F692, Assisted Nutrition and Hydration. Determine if the staff ensured the resident maintained or did not experience an avoidable decline in nutritional status related to the resident's oral/dental condition. Section 483.25K, F697, Pain Management. Determine whether staff have assessed, care planned, and provided services to manage a resident's oral/dental pain. Section 483.35A, F725, Sufficient and competent nursing staff. Determine whether based on the resident's needs the facility had qualified staff in sufficient numbers and with the required competencies to identify dental concerns and provide necessary routine resident dental care. Section 483.40D, F745, Social Services. Determine whether the facility provided medically related social services by addressing any unmet needs related to dental/denture or oral care. Section 483.45D, F757, Unnecessary Medications. Determine if the resident is experiencing an adverse dental/oral consequence of a medication which indicated the dose should have been reduced, discontinued, or any combination of the reasons stated in Section 483.45D15. Section 483.70H5, F842, Medical Records. O. Determine whether the resident's records accurately and completely document the resident's dental/oral status and the care and services provided in accordance with current professional standards and practices. Section 483.70F, F840, Use of outside resources. O. Determine whether dental services provided met professional standards and principles and the timeliness of those services. Section 483.70G, F841, Medical Director. O. Determine if the medical director was involved in the development of dental/oral health policies/procedures and the coordination of care both on-site, as well as availability of off-site providers, and addressed any quality concerns. This concludes the reading of Appendix PP, Regulation Section 483.55, tags F790 through F791.